Hi, my name is Kinley Calloway. I'm a student nurse here at the University of South Alabama, and today I'll be performing my indwelling catheter insertion and removal video, skills checkoff video. To begin, I will verify my order on my patient chart. We have an order to insert/maintain indwelling urinary catheter in place on nurse-driven protocol to remove catheter when indications are no longer present. I will then perform hand hygiene and verify my patient using two identifiers. We have Jaguar J. Jones. Her date of birth is 8/25/1963, 8/25/1963. She has an allergy to penicillin, And I'll also verbalize the indications for indwelling catheter per nurse-driven protocol, such as required immobilization for surgery, trauma, or other therapies to assist in healing of open sacral or perineal wounds in incontinent patients, or acute ventilator-dependent respiratory failure are just three examples. I would then position my trash can, which I'll be using this as my trash can for the procedure, and perform hand hygiene. And before I open the kit, I will just verbalize that I would have clean gloves and goggles on and perform perineal care. For a female, I would be taking soap and water and washing from front to back. And then for a male, I would also be taking soap and water and washing around the glans penis and the scrotum to ensure that the area was clean before catheter insertion to prevent any associated infections or bacteria getting in the ureter. I will now open my kit and place this as my trash can. I will don my goggles and before any of that, I would raise the bed to a working height, lower the side rail, position the patient in dorsal recumbent position with the legs slightly bent to ensure enough space in between the legs for my kit and my sterile field. And now I will begin opening my catheter kit. Normally, if this catheter kit had not been previously opened, it would be opened away from me. I will make note of the 1-inch border around to maintain sterility. And then I will apply my sterile gloves. And I'm just gonna go under like this to make sure that I do maintain sterility, but also get my gloves on properly. And I can now apply this one and readjust whenever each glove is on. Grabbing underneath the cuff. Making sure nothing touches my skin. And then now I can readjust as needed. I will make note that it is hot in my house, and that is why I'm struggling so much. now that my sterile gloves are on, I can touch my sterile field. We will be placing the shiny side in, and I will wrap my field like such, and adjust, making sure there's no gaps between the patient and the field. And I can now place my kit right there, close to the patient. I will attach the balloon catheter, or I'm sorry, the syringe with the water fill in it to my catheter. And remove my paper without touching. And then, now that that is attached, I will, with my non-dominant hand, open the labia and perform perineal care, going farthest away and down, closest to me and down, and to the center and down. And for a male, I would do so by grabbing the penis perpendicular to the body, starting at the urinary meatus and going from tip down to the glans penis shaft, and do so 3 times, and that's how you would perform care for the penis. I will now insert my catheter. And I would insert until urine was returned. And as urine was returned, I would advance 1 to 2 inches for a female, and go to the bifurcation for male. I also meant to verbalize that I would lubricate the catheter beforehand. I do have lubrication in the kit, but I would lubricate 1 to 2 inches for a female and 5 to 7 inches for a male. Now, with my non-sterile hand, I will grab the catheter and inject my water to inflate my balloon and hold pressure on the plunger. And then for stability, grab and release. I would normally throw this away, but I'm going to be using it for a later portion in the video. And I would tug until I meet resistance, and then advance 1 to 2 inches further to ensure that no pressure was placed on the bladder. And then now I will demonstrate how to clamp a stat lock. For the video purposes and the saving of the stat lock, I will not be actually placing it on the patient's thigh. Then I would clamp it at the bifurcation, clamp it closed, and prep the skin according to hospital policy and stick it onto the thigh, making sure it was not too tight so that the patient would not experience any discomfort. And I will now just take it off, place it to the side, and I would ensure that there were no kinks in or dependent loops in the urinary bag, and hang it on to the bed frame, not the side rail. And for this portion of the video, I will be demonstrating how to collect a urine specimen First, I will demonstrate how you would collect a urine specimen from a catheter that has just been inserted. So first, I would have a towel on the ground and a graduated cylinder to catch any excess. I would remove, first I would have my cap, and the inside of this is sterile. So I would place that to maintain sterility flat, and then I would ensure that this does not touch the borders of my specimen cup. Obtain my specimen, reattach, and recap, label, and send to the lab. And then for a urinary catheter that has been placed for maybe a couple hours, just one that's not been placed immediately, we would do a different method in which I would take an alcohol prep pad, clean the port and ensure that it stays clean. Take a 10 milliliter syringe that would be sterile in other cases and attach it. I'm going to claim that as my identified break in sterility. I would clamp the tubing off so to collect urine, attach, obtain a specimen, release, also hold over my graduated cylinder, put my specimen in this cup, recap, label, and then send off to the lab. And then I would unclamp the tubing a little bit more gently than that. At this point, I would clean up. And normally I would throw these things in the trash can. I am saving them, and I would struggle attempting to put it all back into that small bag. At this point, I would remove my sterile gloves, also discard them, and then I would provide perineal care to the patient, and also daily catheter cleansing would be necessary with soap and water. And I would then document how and then I would lower the beds, raise the side rail, position the patient comfortably, ensure that their call button and any of their personal belongings that they would like were within reach, and perform hand hygiene. And then leave the room to go document the type of catheter, the size, the amount of urine, the color, consistency, odor of it, and if we did happen to collect a specimen, if appropriate, I would also document that. And then at this point in time, I would now remove the catheter. I would apply clean gloves. And I do already have my goggles on, but I would also ensure that those were on. And I would assess the amount of urine that was obtained in the bag. And to discard of it, I would use this and put it into a graduated cylinder. And I will just place this right here. And I will now discard by having the syringe fill up according to gravity. I would also like to note, I would normally have a waterproof pad in this area as well that I would wrap everything in to discard. In this case I do not, so I will verbalize it. Seems that everything is nice and filled up. And now I will remove the catheter. And as I said, I would wrap it in a waterproof pad and discard. I would also perform perineal care afterwards. And I did not verbalize in the beginning that I would raise the bed, lower the side rail, as you would performing any procedure, but at this point I would be done with the procedure, so I would lower the bed, raise the side rail, position the patient comfortably, and remove my gloves. My goggles. And I would document how the patient tolerated the procedure, how much urine output there was, the color, consistency, odor of the urine. I'm thinking of what else I need to document because I know there's more. I would also teach the patient how to assess for any symptoms of a UTI, which would be something such as pelvic pain, urgency to urinate, or pain upon urination. And I would also assess the patient 4 to 6 hours after their catheter removal to ensure that they have voided, and if they have not, I would palpate the bladder or, if necessary, obtain bladder scans. And that concludes my indwelling catheter checkoff video.